Hi, I'm Dr. Stacey Folk, and I wanted to talk to you a little bit about the difference between a breast reduction and a breast lift, also called a mastopexy. Now, these surgeries are very, very similar, and really the only difference between them is how much tissue we remove. So if we're looking for a pretty dramatic decrease in size, that qualifies it as a breast reduction. And if it's just lifting the tissue that you have, that is a breast lift. Now, the incisions are similar on both. Typically, we're going to make an incision around the areola, and the final scar is going to be an inverted T or an anchor type incision. We may also do some other things like a little bit of liposuction over here, and with breast lifts, sometimes we're actually adding volume with an implant. But this video is focusing more on not using implants and just doing a reduction or a lift. So trade secret here, we know that our breast reduction patients historically are the happiest patients we ever take care of, because unencumbering somebody of all that extra volume is one of the most wonderful things that can happen. And I know because I've had a breast reduction. So what we want to do to make sure that you're a good candidate and that we're on the same page about things is first to make sure that you're medically a good candidate. And what that means is we don't like doing this in smokers. And if your weight is excessively high, that can help that can hinder healing. So we'll talk to you about when to do this if you're struggling with a very high BMI. We also want to have a mammogram within a year on all of our patients that are over 35 years old. All the tissue that we take off is going to go to pathology. And so there is this kind of this sort of gray zone between just lifting and taking off a little bit of tissue, which is still considered a mastopexy, or lifting and taking off a lot of tissue, which is a breast reduction. So one of the best things we can do is a physical exam and then have you go by what we call a goal bra. So what a goal bra is what you wish you were reaching in your drawer and putting on every day after this surgery. So the band width needs to fit you comfortably here, that you can hook it easily. If it's really tight and you can't get it hooked, you need to move up on bandwidth. Also, get a bra that has a formed cup like this so that we can really estimate the size. Now, leave all the tags on, because if this doesn't fit you well after surgery or it's not comfortable, you can always take it back. And sometimes I have patients that show up with a couple of different sizes just so that we can have things to talk about. Pay a little bit less attention to the actual cup size on the bra. If you're looking at something that's a C, but you feel like that is either too big or too small for you, continue looking at the cup sizes until you see something that you like. Now, a lot of breast reduction patients want to go absolutely as small as possible, but this is where I'm kind of the mom when I come in on this. Number one, we don't want to do a surgery that is not safe for healing, because we do have quite a bit of healing complications with breast reductions, especially at the bottom of the incision right here. And we worry about good blood flow to the nipple areolar complex. So if we're reducing someone too small, we may not have a good blood supply. Also, you need to think about the rest of your body. You need to think about what size your chest is compared to your waist. We don't want to make the chest so small that you feel like your tummy may walk into the room before you do. Also, if you've not had children yet, having a breast reduction or a breast lift really is going to negatively impact your ability to breastfeed. So you definitely want to take that into consideration if you're still planning on having a family, whether you should do this at a younger age or wait until you're done. I look forward to meeting you. You can actually hunt for that gold bra before you come see me. But if you don't, we definitely want to have this as a talking point at a pre-op appointment, and let us know if you have any further questions.